When we talk about vaginal dryness, many people think the solution starts and ends with using lubricant. But let's take a step back and ask the bigger question, why is this happening in the first place? Lubrication helps in the moment, sure, but if dryness keeps coming back, that's your body trying to tell you something deeper. Vaginal dryness isn't just a surface problem. It's often a reflection of changes happening within your hormones, your medications, or even your lifestyle. Hormones play a huge role in vaginal health. Estrogen, in particular, keeps the vaginal tissue elastic, thick, and well lubricated. When estrogen drops, whether from menopause, birth control pills, breastfeeding, or certain medical treatments, the tissue becomes thinner and less able to produce natural moisture. This is why so many people experience dryness after starting oral contraceptives or during perimenopause, and they often don't connect the dots between their medication and their symptoms. Then there's the role of medications like antidepressants. Many of these affect serotonin and other neurotransmitters that are tied to sexual arousal and lubrication. So even if the desire is there, the body might not respond the same way physically. And when you add in stress, lack of sleep, dehydration, or even overuse of harsh soaps, the problem only compounds. It's a reminder that sexual health isn't isolated from the rest of your health, it's part of the bigger picture. So, yes, lube can make intimacy more comfortable and enjoyable, and that's important. But if you find yourself constantly relying on it, or feeling discomfort outside of sexual activity, that's a cue to dig deeper. Ask your healthcare provider to review your medications, check your hormone levels, and talk about vaginal health beyond the surface. Sometimes a small change like switching birth control, managing stress better, or using a vaginal moisturizer can make a huge difference. Ultimately, the goal isn't just to mask dryness, but to restore balance, to help your body get back to producing its own natural lubrication, and to make intimacy feel effortless again. Because when you understand the why behind vaginal dryness, you're no longer just managing symptoms, you're taking real control of your sexual health. When it comes to managing vaginal dryness, most people immediately reach for a lubricant, and while that's a good first step, it's not always the full solution. The real key lies in understanding that lubricants and vaginal moisturizers serve very different purposes. Think of lubricants as your quick fix and moisturizers as your long-term support system. Lubricants are designed to reduce friction during sexual activity. They make intimacy smoother, more comfortable, and more pleasurable. But once the activity is over, the lube washes away and the dryness often returns. That's because lubricants don't actually treat the underlying cause, they only provide temporary comfort. Moisturizers, on the other hand, work gradually to restore the health of the vaginal tissue. They're used regularly, not just before sex, to maintain hydration and support the mucosal lining so the vagina can hold onto moisture more effectively on its own. The type of product you choose really matters. Many people unknowingly use lubricants that contain ingredients like glycerin, parabens, or fragrances that can irritate delicate vaginal tissue or disrupt the natural pH balance. The vagina maintains a slightly acidic environment to keep bacteria in check. And when that balance is thrown off, it can lead to infections, irritation, or even more dryness. That's why it's so important to look for products labeled as *** pH, balanced water-based, and glycerin-free ***. Silicone-based lubes can also be great for lasting glide, especially if you experience more severe dryness, but they can be harder to wash off and may not pair well with certain toys or condoms. Another aspect that often gets overlooked is how frequently you should use a vaginal moisturizer. Applying it 2 to 3 times a week, similar to how you might use facial moisturizer, can help keep the tissue healthy and flexible. There are even products with hyaluronic acid, a powerful humectant that draws moisture into the tissue, mimicking the body's natural hydration process. And finally, let's not forget that comfort is personal. What works beautifully for one person might not for another, and it can take a bit of experimenting to find what feels best for you. The goal isn't just to add moisture, it's to create an environment where your body feels naturally balanced and comfortable, both during intimacy and throughout daily life. Because when vaginal tissue is healthy and hydrated, everything, from pleasure to confidence, flows more smoothly. Now, let's talk about something that often catches people off guard: seeing pink urine. It can be unsettling, and your first thought might be that something's seriously wrong. But here's the truth: not all cases of pink or reddish urine are dangerous. Sometimes it's simply your body reacting to something harmless, while other times it can be a signal that deserves closer attention. One of the most common benign causes is diet. Foods like beets, blackberries, or even rhubarb can temporarily tint urine in pink or reddish. This is known as beachuria, and it's completely harmless. It usually disappears within a day or two once the food leaves your system. Similarly, certain medications or vitamins can cause color changes without any underlying health issue. But when pink urine persists or appears with pain, burning, or a change in urinary habits, that's when it's time to dig deeper. Pink urine can indicate the presence of blood, known medically as hematuria. Sometimes this happens after vigorous exercise or intimacy, especially if there's minor irritation to the urethra or vaginal tissue. But it can also point to more serious issues like urinary tract infections, kidney stones, or, in rare cases, problems higher up in the urinary tract. The tricky part is that not all causes of blood in the urine come with pain. Some are silent, which is why it's important not to ignore it or assume it will go away on its own. Hydration plays a big role here too. When you're not drinking enough water, your urine becomes concentrated, which can make even a small amount of blood appear darker or more noticeable. Increasing your fluid intake helps flush out bacteria and keeps your urinary system functioning smoothly. And if you're using lubricants or intimate products, make sure they're gentle and pH balanced. Some harsh ingredients can irritate the urethra and contribute to discomfort or inflammation. If you ever notice pink urine in more than once, or it's accompanied by symptoms like pain, fever, or a strong odor, don't wait it out. A quick urinalysis at your doctor's office can rule out infection or other underlying issues. Most causes are treatable once identified, but early detection is key to preventing complications. The takeaway is this: while pink urine can sometimes be harmless, your body deserves attention, not dismissal. Listening to these small signs early on can prevent bigger problems later, and that's what proactive self-care is all about. When it comes to long-term comfort and confidence in your vaginal and urinary health, it's about more than just quick fixes. It's about building a holistic care plan that supports your body from the inside out. Everything is connected: your hormones, hydration, pelvic floor health, and even your emotional well-being. Addressing these factors together helps restore balance and makes lasting relief possible. Start with the basics: hydration. It might sound simple, but adequate water intake keeps tissues plump and elastic. Dehydration affects not just your skin, but also your vaginal lining and urinary tract. Aim to drink consistently throughout the day, and remember that caffeine and alcohol can dry you out, so balancing them with extra water makes a real difference. Next, focus on hormonal health. If you're experiencing persistent dryness or pink urine, your hormones may be playing a role. Estrogen, in particular, helps maintain vaginal tissue thickness and elasticity, and low levels can cause both dryness and increased sensitivity. This is especially common after menopause or in those using hormonal birth control. A conversation with your healthcare provider about vaginal estrogen creams, rings, or non-hormonal alternatives can be transformative. These treatments work locally, restoring comfort without significantly affecting your overall hormone levels. Pelvic floor awareness is another key piece. The pelvic floor muscles support your bladder, uterus, and vagina, and when they're either too tight or too weak, they can contribute to discomfort, pain during intimacy, and even urinary symptoms. Gentle pelvic floor exercises, or working with a pelvic floor physical therapist, can help restore muscle tone and blood flow, improving both lubrication and sensitivity. Your daily habits matter just as much. Choose breathable cotton underwear, avoid harsh soaps or douches, and use pH-balanced washes designed for the vulva, not the vagina. Incorporate movement into your day to keep blood circulating and prioritize sleep because your body heals and balances itself best when it's rested. And finally, don't hesitate to have open, judgment-free conversations with your healthcare provider. Persistent dryness, discomfort, or pink urine isn't something you should have to just live with. Often, small adjustments, whether to medication, diet, or hygiene routine, can create significant improvements in how you feel. When you care for your vaginal and urinary health as part of your overall wellness, you're not just managing symptoms, you're reclaiming comfort, confidence, and control over your body.